Welcome back to Inner Ear Secrets, where we discuss all things audiology related. Okay, so, Gail, I've got a really interesting question for you today.
Okay.
What is your biggest red flag?
What kind of
Mm,
red flag?
I don't know, you tell me.
Give that a think.
I'll go first. Audrey, you can have a think. I am going to say being secretive is a very big red flag.
Ooh,
She said she likes open communication.
Exactly.
Hmm.
that's an interesting one.
I guess off the outset, like a red flag, ego. I like confidence. And I think there's a way to
Mm,
be confident without the need
mm,
of a big ego.
Right.
mm.
Yeah. What about you, Sarah?
I think for me, it's like more someone not being confident. Because I feel like I don't like let's hear me out, okay? I feel like yeah, too much of an ego is bad, but I feel not confident enough is also pretty bad because I feel like I don't want to be the one reassuring you, you
Okay,
know?
I get that. I get that.
Yeah,
I think there's a balance there to strike,
for sure.
for
Yeah.
sure.
But today we're not talking about relationship red flags. We're going to be talking about audiology red flags.
Ooh.
These are those kind of sneaky signs that might mean that you have to go and see an audiologist or send your loved one to see an audiologist ASAP. Hearing is one of our most vital senses, and so any changes in it can completely impact our lives. So it's really important that all of you know about some key red flags that we're going to share with you today. To begin with, Ardra, what are your audiology red flags?
If we're gonna start, we've got to go big. I think the most urgent one has to be a sudden sensorineural hearing loss. So let's break that down a little. Hearing loss, we know what that is. It's when you feel like your hearing is starting to diminish just a little bit. Sensorineural. We have not discussed this yet. So we have different types of hearing loss. We can have hearing loss where sound is traveling into the ear and is perhaps being blocked in its path to reaching the hearing organ and then sending those signals up to the brain. That can be at the eardrum itself. It can be at the little bones in our ears called the ossicles. So we have three of those. We have the malleus, the incus, and the stapes. So sound needs to get through, and sometimes we have a hearing loss there. Other times we can have a hearing loss at the level of the hearing organ itself. So sound is able to get in perfectly, but maybe the sound is not being processed well by the hearing organ. And that could be maybe there's damage to it. There's some cells in there that need to be quite sensitive to sound. And maybe they're not working as well as they should be. So that's what it means to have a sensory neural hearing loss. And that's often more permanent in nature. We've broken down hearing loss, we've broken down sensory neural. So sudden. Sudden means that you go to bed and you wake up the next day and perhaps your hearing has just dropped completely. It might have just dropped, as in you can still hear, but it's worse, or it's gone. And it is crazy that so many people do not know about this. And I didn't know about it before I started the course, but it is one of the most urgent things that can come up in an audiology clinic.
What are some of the symptoms that people present if they have a sudden sensory neural?
So usually the patients would report obviously that sudden loss of hearing. You can detect your hearing is changed by something that's quite discernible is what we're looking for. We often see that people report ringing in their ears, tinnitus, not tetanus, tinnitus.
Tinnitus.
It's definitely not tetanus. Tetanus is completely different, but they can often report tinnitus. You can feel like there's a bit of fullness in the ear, so something blocking the ear, and sometimes a bit of ear pain, or you can even get some dizziness or vertigo. So maybe you're still, but it feels like the world is spinning. So it's super important that you seek medical attention if you or a loved one have these symptoms. Early intervention is your best friend when it comes to this.
Yeah.
Mm.
So I guess like the next question that's probably on everyone's mind is if you do have that early intervention,
Mm.
does hearing get back to normal?
While there are ways to help with this, there's no way to guarantee that the hearing will return to normal even with the treatment. So in Melbourne, we are really fortunate to have an eye and ear hospital with an emergency department where we can send patients for urgent care. So what this involves is there being an ENT specialist, so an ear, nose, and throat specialist, who will decide on the best course, which may be oral steroids to help reduce inflammation in the cochlea or hearing organ. And sometimes they can also deliver these steroids via a needle through the eardrum. So it's really important that you are going there straight away, because a lot of time these sort of interventions, such as delivering steroids, would only work maximum 4 weeks since the hearing has dropped. We suggest you go straight away as possible. Whenever you do notice it, it's important that you get there straight away.
Yeah, I think it's also really important to note that in other contexts, you can also get help. As soon as you notice your hearing has changed, or if someone you know finds out that the hearing has changed, it's important to go and seek medical help from a GP. And if you can't see a GP immediately, just go to the nearest emergency department you have around you.
Yeah, exactly.
Has either of you experienced this in the clinic?
I've seen it once.
You've seen it?
I think.
Tell us more.
Yeah. It was a young person, so we were quite shocked. But this was the first clinic. So we were doing an observation, and basically, patient came in, reported that they have pain and what was it called? They had this sort of like pus coming out of the ears. I can't remember the exact term he used. He used a term to describe it. He said something like goo came out. And then he was just saying, oh yeah, I always listen to music only in my right ear. And so we were like, oh, it's probably just an acoustic shock or something like that. He listens to music too loud on one side. Because he was quite young, so we weren't expecting it. And then we got the audiogram back, and it was a sudden sensory, so he had to go see the emergency ENT after.
Oh, wow.
Yeah.
I think I've seen this in clinic. The person came in too late. We send you to the emergency ENT the same day. Just get in, they'll do it for you. But I think this person, it had been maybe 2 months. And they came in with other stuff as well. But by the time they came in, it's too late to do anything about it.
Right.
I've seen someone that came in, it was 15 years has passed since his first sudden drop of hearing. So I'm not sure if he went in straight away or if he waited. When we saw him, his hearing loss was already profound in the year that had the sudden drop.
A profound hearing loss is you've got no discernible hearing. There's close to nothing there, is what a profound hearing loss means.
Yeah.
Yeah.
If you have to pick the king of red flags, there you go.
Yeah. Some sensorineural guys. I guess the next red flag that I want to bring up would be balance and dizziness issues. I feel like a lot of people don't know that you need to see an audiologist for that. Something that people think audiologists, hearing aids, they don't think audiologists and balance. It's important that everyone knows that if you do have any balance issues, you can see a doctor, but you can also see an audiologist to get that checked out. Because for those that don't know, the inner ear is really important for balance. Just to break it down a little bit more, your inner ear is made up of your cochlea and your semicircular canals, and you also have these otoliths. So any sort of damage or inflammation in the semicircular canals or the otoliths can cause vertigo or dizziness. So if you're experiencing any sort of unexplained dizziness or balance problems, it could be related to the auditory system, so the inner ear. And seeing an audiologist could help you diagnose or treat these issues. Yeah.
When I tell my friends about these sort of symptoms, most of them ask about their dizziness when they get up from their seat or they get up from bed. So I feel like maybe we should make a distinction between vertigo and dizziness.
Definitely. So dizziness is a broad term. It describes a range of sensations. It can be a feeling of distortion, a sense of space, and might also be described as feeling lightheaded, faint, unsteady, or woozy sometimes. When people say they feel dizzy, they might feel like they're about to lose their balance, or they might pass out as well. So, vertigo, on the other hand, is characterized by the sensation that you or your surroundings are spinning or moving, when there is no actual movement. Think of it like being on a merry-go-round that suddenly starts spinning very fast. This sensation can be quite intense and often comes with nausea, vomiting, and trouble walking or standing. So it feels like you're being still and the world is spinning around you.
So, to clarify, dizziness is more general and vertigo is more specifically that spinning sensation. Am I right about that?
Exactly.
So that's why we like to differentiate, and you might find that your vestibular or balanced audiologist might like you to explain a bit more when you do present symptoms like this.
Yeah, and I think that's with the first step of the appointment is asking you what are your symptoms, whether it's you feel like you're spinning or the room is spinning around you. And then the testing procedure we go about based on what you tell us as well. So it's really fun. It's like navigating through a puzzle piece, trying to figure out
Mm.
what sort of disorder it is that's causing all the dizziness or imbalance. So we learned a few of different testing procedures. What are you girls' favorite so far?
I would have to say probably the V hit because it's just such a crazy test that we do in clinic. And just the context, we're putting our hands on the patient's head and then we're just like moving their heads like that. I swear that's like
Oh
a full on
God.
like workout session. Yeah.
Mhm. So for our listeners that are just listening, Sarah was demonstrating before with her hand. So if you want to see that in action, head to YouTube and have a look at our video there.
Yeah. So, for some context, VHIT is a balance test that we use to check the function of the semicircular canals. So, these, like Sarah mentioned before, make up part of the cochlea and the balance organ. And with this test, I can move the head in order to activate any of those semicircular canals. So, what happens is the patient wears goggles with a built in camera because what we are essentially doing is using something called the vestibulo-ocular reflex in order to measure what is happening. It's looking at if your eyes are moving in conjunction with your head. We move the patient's head quickly to the side, and the camera records the patient's eye movements, which tells us if the semicircular canals are functioning. And we can give you an objective measure of that. That's some really cool tech there. I remember my
Mm.
first time in a vestibular appointment and I was gobsmacked. I was like, oh my goodness, this stuff is so cool. And for a while, I was calling V-HIT the little goggles test because it's a smaller goggle that you wear in comparison to another test that we do.
Mm.
That's also checking eye movements.
That is actually so true.
Yeah, so this is what I did.
Yeah, it's smaller.
So we've got something called gaze testing as well, where we're just looking at how the eyes are moving. If you've got flickering in your eyes, that can point to some problems with your balance or that there is something that's causing your balance to be affected. And I called that test the big goggles test because I didn't know anything about this. And V-HIT was the little goggles test. And then come 6 months later, I knew exactly what I was talking about. So there you go.
Mm.
Yeah.
Wow. I still remember when they were doing it in clinic.
Yeah.
It seemed really easy how they can just grab onto the
Yeah.
patient's head and
Yeah.
turn.
Mm.
But when we were practicing the prac, it's actually so hard. The precision that you have to apply, the pressure that you have to apply, it has to be very precise and too fast or too slow, and you can't turn too hard. You can't give the patient too much force. You also have to hold onto their heads with enough force so that you have control as well.
Yeah, exactly. Yeah.
Quite a bit of techniques in there.
Yeah.
I'm always like afraid that I'm going to push their head too hard. So it's like really hard to just go in and be like, oh, I'm just going to turn your head. And then if you don't give enough force, you're not going to get the eye movement you want. And so
Mm.
I remember practicing it with someone. I turned her head a bit too much. Like, I think she had a little strain because I was like, you got to do the short, strong ones. Traumatizing for her.
That's all right.
Yeah.
Mm.
You know what? You live and you learn, and you are in
Right.
the process of learning.
Exactly. So we've talked about some of the disorders to do with hearing. There's another one that's a really fascinating red flag that I learned this year is about having normal hearing, but still struggling with processing sound. So in audiology, we call this auditory processing disorder or APD. This disorder is not caused by any hearing impairment, but it's by how the brain interprets sounds. Your ear might be still picking up the sound, but your brain is not registering, so you're still unable to know that you're hearing the sound.
So, what are some of the symptoms that people should be on the lookout for APD?
So people should be looking out for difficulty understanding speech or poor listening skills, or for children it'll be academic challenges as well. So if they're not performing as well in class, it could also be due to APD, or there could be behavioral and social issues. If you're feeling fatigue from listening, it could also be because of auditory processing disorder.
Yeah. So I have a question though for both of you,
Mm.
because we can talk about symptoms and everything here, but
Mm.
most of the people that we diagnose with APD are kids,
Yeah.
right?
Mm.
So how do we spot these symptoms? Because it's the adults' responsibility to spot them. How do you think that adults should go around trying to spot these symptoms?
I think it's important for the parents to pay attention to the kids, especially if they're not performing as well at school, or if they're not very responsive around the house. It could be because they have a hearing disorder or auditory processing disorder, and not just a normal hearing loss. Or if they're not socializing as well with other kids. Any of these could be red flags that it is auditory processing disorder. Bringing them to see an audiologist early on is very important in terms of management and intervening with the disorder.
So early diagnosis and intervention are key for helping individuals with APD develop more effective coping strategies to improve their auditory processing skills. So if you know someone or you think you might have APD, consult an audiologist for a bit more of a comprehensive evaluation and a tailored treatment plan. We have just recently learnt of the different strategies that we are able to implement with someone with APD. They're helping all parts of the brain and processing that you do. That pretty much would be your next step into seeking help. But just a side note, not all audiologists are specialized in APD assessment and management. So it's important to look for someone with this specific specialization. Their treatment plan might include strategies like auditory training, reducing background noise, and educational support.
So today we discussed all the different types of red flags that we think are important, but there are definitely more red flags out there, and it's important to get any sort of medical help when you see any of these red flags. Remember that early intervention and detection is so important for hearing health. And if you know someone who's experiencing any of these symptoms, ask them to go and see an audiologist ASAP. Thank you all for listening to Inner Ear Secrets today. We hope that this episode was super informative for you. And if you really enjoyed this episode, I hope that you will subscribe to the podcast and make sure you follow us on Instagram and TikTok at Inner Ear Secrets Pod, and find us on YouTube as well. Until next time, take care of your hearing and keep listening.
Bye.
Bye bye.